We are back with Dr. Lester Borden, the prostate cancer medical director at Cone Health, and we've been discussing the disease and what you need to know about it. In the last segment, you mentioned PSA screening for prostate cancer. Does an elevated PSA always mean that the man has cancer?
So no, not necessarily. An elevated PSA simply means that a man may be at a higher risk for prostate cancer, and it should prompt them to undergo further testing or evaluation by a specialist at that point. But there can be other reasons to have an elevated PSA that don't always mean cancer.
Okay. Now, there's no way to prevent the disease, but are there steps that men can take right now to reduce their risk for prostate cancer?
Yeah, well, I typically tell patients that a heart lifestyle is also a prostate healthy lifestyle. And so there's no one thing that men can necessarily do to prevent prostate cancer, but they certainly may improve their chances by eating a heart healthy diet, regular exercise, limiting or avoiding tobacco and alcohol use, and maintaining an appropriate body weight. Many of the things that we all need or all know to do and need to be doing better anyways.
General good health there. Okay.
Absolutely.
All right, so some men put off going to the doctor. We kind of touched on that too in the last segment. How concerning is that when it comes to getting screened for prostate cancer?
Right. Well, as we discussed earlier, prostate cancer will typically cause absolutely no symptoms until it's already reached an incurable stage. So I would highly recommend men getting their routine preventative health screenings by their primary care provider to avoid missing a prostate cancer at a time when it still may be curable. So listen to your wives.
Good advice. All right. What popular misconceptions are out there about this disease?
Yeah, I think many men have gotten a little bit of a mixed message about prostate cancer over the years, with men sometimes hearing that it's often not life-threatening at all, and then sometimes the next day hearing that it's lethal and the second leading cause of cancer death. And this seems like a paradox, but in fact, they're both right. We now understand not all prostate cancers are the same. And probably maybe the biggest change over the past couple of decades in managing prostate cancer has been that we can now really differentiate between those aggressive and non-aggressive types of prostate cancer. And so this has allowed us now to truly personalize care for each individual man to suit their particular situation. So while many men may require aggressive treatment, such as surgery or radiation for their cancers, for most of the non-aggressive prostate cancers, we now recommend something called active surveillance, or a process basically of monitoring their cancer rather than aggressive treatment that may cause them side effects. So truly moving toward more personalized medicine.
Mm-hmm. And I know sometimes a lot of people don't go to the doctor because they're like, I just don't want to have to pay that doctor bill, or I don't have insurance, or I've got a gap in insurance right now. Cone Health Cancer Center has several free screenings coming up. Let's talk about who is eligible and then how do they sign up?
Yeah, so we've created an early detection prostate cancer program through the Cancer Center at Cone Health, and this is for men ages 45 to 69 in the community who either don't have a regular physician or have not had the opportunity to undergo prostate cancer screening through their primary care provider, but are interested in possibly doing so. And what we do is provide education about prostate cancer screening there, and then followed by a PSA blood test if a man chooses to proceed. And if interested, you can call 336-832-0849 to register, and these are typically running all through September, sometimes even into October.
All right, and if you didn't get that number, we're going to put it in the web story, but I'm sure when you call Cone Health as well, when you say I'm looking for that free screening, they'll direct you to the right spot. All right, we've got about 1 minute left. What final message do you want to tell folks about prostate cancer?
Sure. I think it's just important that men become as educated as they can about prostate cancer. I mean, it's certainly a very serious issue for many men, but they shouldn't be fearful of it. And with routine health checkups, appropriate counseling, most men will be diagnosed at an early stage where the impact of their cancer in their life really can be minimized. And we're really quite fortunate in Greensboro to have some very highly trained prostate cancer physicians, some of the most up-to-date technology for both diagnosing and treating prostate cancer. So for those men who will need treatment, they should really feel better that some of the best technology and experience for treating prostate cancer is right here in their own community.
Mm-hmm. And they don't have to travel for it. Thank you so much for your time. We appreciate it. We don't want you to miss any of this information here. In a few minutes, we're going to have everything that we just went over on our website. Just head over to the To Your Wellbeing section.